Hello, my name is Emily and I'm a reproductive genetic counselor at the University of North Carolina at Chapel Hill. We know when you first become pregnant there are many decisions to be made and it can all feel a little overwhelming. The purpose of this video is to provide information about one of the tests available in your pregnancy. Specifically, we're going to talk about a screening test that helps identify pregnancies at increased risk for Down syndrome, Trisomy 18, or Trisomy 13. Down syndrome, sometimes called Trisomy 21, is one of the most common genetic conditions seen in newborns. Each child with Down syndrome is unique. Children with Down syndrome typically have intellectual disabilities and differences in their facial features. Some babies with Down syndrome may be born with problems with their heart or have other medical problems. Some adults with Down syndrome are able to live independently, and others may need more help from family members or other caregivers. Down syndrome typically happens by chance and does not usually run in families. Trisomy 18 and Trisomy 13 are both less common than Down syndrome. Babies with Trisomy 18 and 13 usually have severe birth defects. Many pregnancies with these conditions result in stillbirth or miscarriage. Like Down syndrome, Trisomy 13 and Trisomy 18 typically happen by chance. First trimester screening involves a blood test and an ultrasound. Usually the blood test is done through a finger stick. If you have the test done the same day as your ultrasound, a genetic counselor will call you within 5 days to discuss your test results. Alternatively, you can have the blood test collected as early as 9 weeks gestation through your doctor's office. The results are usually available the same day as your ultrasound, as long as the ultrasound is done at least 1 week after the blood test. The ultrasound measures the amount of fluid at the back of the baby's neck. This is called the nuchal translucency, or NT. All babies have some fluid at the back of the neck. An increased amount of fluid indicates an increased chance for Down syndrome, Trisomy 18, Trisomy 13, or other health conditions. However, not all babies with extra fluid will have a health problem. The nuchal translucency measurement can be obtained between 11 and 14 weeks gestation. In some cases, the ultrasound may also be able to determine whether the nasal bone is present or absent. This can provide additional information about the chance for Down syndrome in the pregnancy. The blood test measures proteins in your blood made by the growing pregnancy. If the levels of these proteins are different than average, this may indicate an increased chance for Down syndrome, Trisomy 18, or Trisomy 13. The results will either be reported as within range or increased risk, and a specific chance for Down syndrome, Trisomy 18, and Trisomy 13 will be reported. The results may indicate the chance for a health problem to be as high as 1 in 10 or as low as 1 in 10,000. A within range result means that the chance of Down syndrome is less than 1 in 300, and the chance for Trisomy 18 and Trisomy 13 is less than 1 in 150. An increased risk result means your result is above our screening cutoff. Remember, this does not mean the pregnancy is affected with any of these conditions. About 1 in 20 women who have this screening test will come back with an increased risk result. Most of these women still have a healthy pregnancy. If your results indicate an increased risk, you will meet with a genetic counselor who will discuss further testing options available in the pregnancy. These testing options may include free fetal DNA screening, chorionic villus sampling, or CVS, amniocentesis, and ultrasound. Free fetal DNA screening is a more accurate screening test than first trimester screening, although it is currently only available to high-risk pregnancies. CVS and amniocentesis are both considered diagnostic tests. This means that they give a yes or no answer about these conditions. However, they both involve taking a sample from the pregnancy, which means they carry some risk for miscarriage or other pregnancy complications. First trimester screening is optional. It's important to think about what you would do with the results. Some couples want to know if there's an increased risk for Down syndrome, Trisomy 18, or Trisomy 13 in the pregnancy, so they can decide if further testing is right for them. Other couples decide that they don't want to know if there's an increased risk for these conditions in the pregnancy. If you choose first trimester screening, you may be offered a blood test after 15 weeks gestation called the alpha fetal protein, or AFP blood test. This blood test helps identify pregnancies at increased risk for open spina bifida or neural tube defects. These types of birth defects are openings along the spine. Ultrasound at 18 to 20 weeks gestation can also identify many of these birth defects. If you do not have first trimester screening, you will be offered a different blood test after 15 weeks gestation to screen for Down syndrome, spina bifida, and trisomy 18. This test is called the quad screen. If you do have first trimester screening, you won't need to have a quad screen because you will have already been screened for Down syndrome and trisomy 18. If you have more questions, you can request an appointment with a genetic counselor early in your pregnancy to review all your screening and testing options.